I'm Dr. Russ Jaffe, and it's a pleasure to be back with the ICIM family, saving hearts one at a time, helping people recover from chronic illness. And this year, my focus is on cardiovascular disease in the city of brotherly love, and more particularly, the use of predictive biomarkers interpreted to best outcome goal values. So in essence, we will teach how to avoid looking at the statistics of lab tests. In fact, if you fold it over the right-hand part where they give you a range, you would be better off, in my professional laboratory opinion. And as a clinician, I know the limitations of ranges, and I know the power of predictive biomarkers in regard to cardiovascular health, but in regard to all-cause morbidity and mortality. So I'm going to synthesize the last half century of my meanderings and scientific endeavors, starting in academic medicine at Boston University, continuing at the National Institutes of Health, and staying on their permanent senior staff, doing cardiovascular research with Don Fry and Bob Maley. You may not remember them, but Don Fry is the one who showed that at bifurcation points where turbulence occurs, when blood pressure goes up, there's more cardiovascular disease. And Bob Maley coined the term lipoprotein. So I'm dating myself now in the mid to late 70s when I was at the clinical center. And for the last 3 decades, I've been working with colleagues to help them understand the value, the meaning, and how to interpret lab tests for individuals so that we can use nature, nurture, and wholeness as our guides, that we can apply physiology before pharmacology. This means the use of intelligent, standardized natural products wherever possible, based on biochemical individuality. Because last time I checked, when I went to a doctor, it was all about me. And when most people go to doctors, it's all about them. And they may have actually found interesting information about their condition online, because they're only interested in their particular condition, whereas we as clinicians are supposed to know everything about everything. And so I will be sharing a lifetime of clinical and research, laboratory, and practical work with the emphasis on what you can do in practice next week to improve outcomes, to reduce risks, to wean people off of unnecessary pharmaceuticals, and to enrich them through their kitchen, through makeover in their bedroom and their bathroom, by reducing by 80% the total toxic burden that comes into our lives. It can be done. We've done a makeover ourselves. Behind me, I don't think you can see it, but behind me is a garden. It's our front yard with 250 edible medicinal plants, and we eat what we grow. And my job is to watch the pollinators, that's the bees who do come when the flowers are out. And by the way, a new flower blooms every day of the year in our garden. Come see. You're welcome to enjoy the nature, nurture, wholeness in practice approach. For some of you who don't know my work, I came as a skeptic. So if you have questions, I too have questions. On the other hand, I've had experiences with my own family, with my children, with my parents, with myself. And the bottom line is we can indeed save 1 million lives a year. 500,000 from the consequences of diabetes, because diabetes kills and costs, but diabetes is a choice. Then we have 250,000 people who die from nutritional deprivations, including sometimes in medical institutions where nutritional compromise is the rule and nutritional sufficiency is rare. And then, of course, we have 250,000 people who seem to die early from the consequences of a healthcare system based on how much you can spend, not healthcare as a right. And my point of view, which I will summarize in the presentation, is that in our Declaration of Independence, we have the right to pursue happiness. To me, that means that healthcare must be a right, because I promise you, you can't pursue happiness if you're feeling unwell or worse, as many people do, and they survive and get by, often with a combination of polypharmacy and advice, and intrusive approaches that I tend to avoid. So I'm very much interested in the science, but also in the practice, and I'm eager to share with you what has worked for us over thousands of cases. And we have now going on 80,000 cases in our database. We've done 25 million cell cultures. We really have a high degree of confidence in our precision and in our interpretations based on best outcomes not based on making people into statistics. So with the wonderful program that ICIM has put together, and I hope you will find mine also both entertaining and informative, I look forward to being with you this coming March in Philadelphia, the city of brotherly love, and a wonderful place in a good part of town where it's easy to walk, jog, or exercise. So come join us for the ICIM event of the year, Philadelphia, March this year, and my privilege is to talk about predictive biomarkers and how that applies to saving cardiovascular systems and individuals one at a time.